for Tuesday, September 12th, 2023. And if you can start with a roll call, that would be great.
Mayor Condrey?
Here.
Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Sipsey?
Here.
Ms. Lawley? Mr. Bonnell?
Here.
Dr. Zollett?
Here.
Ms. Miller?
Here.
Do we have a motion to excuse Ms. Lawley from the meeting? Is she the only one I missed?
I think that's it. Second.
All in favor?
Aye.
All opposed? Okay, and we have a new Board of Health member today. Emily, would you like to introduce yourself to everyone?
Hi everyone, I'm Emily Miller. I'm an infection prevention RN at Atrium. I live here in town with my husband and 3 kids. They keep me busy. They're 9 and my set of twins are 6. So, yeah, they keep me real busy. So, that's a little bit about me.
Great. And thank you for
Yeah.
joining us. I'm sure the Department of Health they have probably the best onboarding for any board or commission that I've seen, so hopefully they'll get you if they haven't already.
Yes.
Some good information. Awesome.
I met with Emily and we've been working together for a long time because
While.
infectious disease, yeah, infectious disease, you work so closely with Atrium and they've been a wonderful, wonderful partner. And when we started with COVID, remember we had to go to the ER
We did. I
and call
remember.
CDC.
Yes, we did.
And we even had at the time Keith Bricky meet us there at
Yes,
10
we did.
o'clock at night at the beginning. So, yeah, so welcome Emily and so
Thank you.
glad to be working with you.
And so I think you're filling the vacancy that goes until the end of the year, correct? And then if you decide you want to keep joining the group, you can reapply to it. So thank you for stepping in.
Sure.
Okay, do we have any citizen comments this morning?
I saw your name in the paper a couple of times.
Oh yeah?
Yeah.
Hmm.
You won some award, you won competition in
Ah.
where, North Carolina, South Carolina?
Yeah, I was gone last week, went to compete at US Nationals, and we won a gold 3rd year in a row, so take it.
Well, I'm impressed. I'm afraid of heights, so I think that's impressive.
Congratulations.
Any other citizen comments? That was one of 2 we've had since I've ever been here, so thank you.
Oh.
Okay, so today we have public hearings. We'll open and close those for any public comments. So the first one is ordinance number 2023-01, food fees. I guess we're not really presenting it, right? We're just gonna
Just open, yeah.
just open the, okay, so we don't have any staff wanting to present again. No, it's okay. So with that, we will open the public hearing for ordinance number 2023-01 for any comments in favor of the ordinance.
And I have not received any comments regarding the fees.
We don't have to first and second that,
No, that's for voting. Just for a public hearing, we can just open it and close it as far as I'm,
Mhm, that's good.
maybe I'm wrong, but no problem. That's the way to do it, council, this, other groups are different. Okay, I don't hear any comments in favor. Do we have anyone in opposition to ordinance number 2023-01? Okay, hearing no movement, we will close the public hearing for ordinance number 2023-01, and we'll open the public hearing for ordinance number 2023-02, campground licensing fees. If we have anyone who'd like to speak in favor of this, you can speak now. Okay, hearing no movement or voices, if anyone has anything in opposition, they'd like to speak in opposition to 2023-02, you can speak now. Okay, with that, we will close our public hearing for ordinance number 2023-02, and we'll go on to approval of minutes, August 2023. Did anyone have any corrections to the minutes before we make any motions? Okay, do we have a motion to approve the minutes for August of 2023?
Second.
All in favor?
Aye.
All opposed? All right, financial report for August of 2023. Any comments or questions on that one before we make any motions? Okay, do we have a motion to approve to receive and file the financial report for August of 2023?
So moved.
Second.
All in favor?
Aye.
All opposed?
May I just make one comment too? We just received, Carla, correct me if I'm wrong, 20,000? Was it even from tobacco 21? 30,000? Sometimes we get grants mid-year, and so that becomes always when finance talks to us about, can you give us some idea when you're gonna get grants? This was from Interact for Health to help us with the Tobacco 21 initiative. Remember, we're gonna apply for the grant. I think it's a total of 84,000 over 2 years, and so they gave us 30 this, we just received the first 30,000. So often you'll see in our budget, an increase in our revenue that is not expected because it just comes in from different grants, so I just wanna make note of that. They'll probably have a line item for it, we'll see how they set it up next year as far as a line item to go into. If not, it's always found in your expense area in miscellaneous. And that's in that page, the last page of the finances, like the reimbursements, because that's where we just put, unexpected cash down in here. We can't spend it, cause it always has to be appropriated, but it always goes in here until, we go into the next budget year if we're gonna use some of it. But it's always showing a balance here on this last, budget page, if you guys will, so, that's it.
Thank you.
Mhm.
Okay, our education presentation today is on rabies. Sarah, are you the one presenting for us?
This is Sarah Cheney, for those that do not know, she is our sanitarian in training, or also environmental health specialist in training, because that name changed.
Okay, so, we do, I think, 10 programs in environmental health, and rabies is one of them. It's just one of the ways that we try to keep the community safe and healthy. So I'm gonna be talking about that today. So, a little overview about what rabies is. It's a deadly virus that attacks basically your nervous system, in animals, and it can be transmitted through contact with saliva, neural tissue, open wounds, and mucous membranes, so that's where bites become an issue. It's always, almost always fatal once clinical symptoms appear. There are less than 20 documented cases ever of humans surviving rabies once they become symptomatic. So, with the signs and symptoms in animals, there's kind of this growing things, like I've seen Facebook pages where people are like, oh, I'm gonna pet this wild animal and it's great, but really that's not a good idea, because when they are unusually tame and they're more likely to approach you, they're out at the wrong time of day, they're just acting weird, that can be an indicator that they do have rabies. When humans have rabies, it'll start with flu-like symptoms, so they'll have a fever and they'll just feel really sick. And then it's followed by a neurologic period, which is where things like amnesia, paralysis, people will be afraid of the sensation of air being blown on their face or drinking water. It's not good, so that's what that looks like. And then this just kind of summarizes again the pathology of the virus. So it's typically, an infected animal will bite another animal, and then that animal isn't probably gonna show signs for a while. But once it does start to show signs and it's in the brain, then the animal will die very quickly. Next. Thank you. With rabies in Ohio, it's mainly in wild animals. We haven't had a human rabies case since 1970. However, Indiana did have one in 2009, which is kind of recent. I didn't realize that. We do have bat strain rabies throughout the state, including in and around Butler County, pretty consistently every year, and we'll take a look at some maps with that. Raccoon strain rabies entered the state at the Ohio-Pennsylvania border in 1997, and the state of Ohio does some really cool stuff with preventing rabies from entering the state with that. So I just kind of looked at the last 5 years. So in 2018 we had Butler. It's kind of hard to see, but the blue are bats, and then green are raccoons. So the green, again, more over by Pennsylvania. So in Butler, 2019, not in Butler, but in and around, so green, more in Hamilton County. And in 2020, I'm not sure what happened. Apparently all the animals were quarantining too. But in 2021 and 2022, again, thankfully nothing in Butler County, but it is very close to us. So we looked at all of our data from 2019 to 2022 of the city of Middletown's animal bite cases and kind of what became of those. So to kind of explain this a little bit, the whole bar is the entire, like the total number of cases for the year. So in 2019, we had 111 total bite cases. Of those, 67 were animals that had an owner, 4 were wild animals, and then 40 were strays or just animals we can't identify the owner or the animal. So it kind of stays pretty consistent. As far as species go, the largest number of animal bites we deal with come from dogs, overwhelmingly. We have just a few stragglers of raccoons, bats, cats, and we did have 1 groundhog in 2019.
I heard those things can be
I know.
really mean.
And
That
people
was
wanna
me
pet
probably.
'em. Yeah. Like, leave 'em alone. And then with the dogs, we kinda wanted to look at what breeds are biting more than others. And of course, like, a lot of things play into this, you know, treatment of the animal, was it provoked or not provoked, things like that. But just to kind of get an idea, these are our top 3 right here. And then this unidentified breed, this is actually 33%. So this is when we get a bite report and the animal might be stray, and maybe the person doesn't know what kind of dog it was, or it was a mixed breed, it was dark outside and they couldn't see very well. And then pit bulls are actually 28%. Every other category is right around 3 or 4% or less, so it's a pretty big majority.
Did I see Chihuahuas?
Yeah,
Good
they're
chunk there.
a close runner-up. They're only about 3 to 4% though, and same with German Shepherds. But these are our top 3.
Yeah.
These guys are the most by
And they're-
far.
Don't you think they're reported more, those larger dogs, because they probably do more damage?
Yeah, absolutely.
Because we know that
Sure.
small dogs are vicious.
Yeah.
Carla's dog is gonna bite you every time you think about coming over her house. But, they're usually smaller bites though. I think most people don't report those smaller ones as much as the bigger ones where they're usually pretty
I have a
severe
question,
bites.
with the German Shepherd, majority of police dogs are German Shepherds.
Yeah.
Are those counted in those numbers when they?
We had a police bite, like, involving a dog, and it was during where the police officer had asked the dog to do his
Like a
job
training?
kind of thing.
Oh,
Yeah.
oh, okay, to
And
do his
then-
job, that's what I mean, like.
Yeah, like, yeah,
okay.
it wasn't like it turned on the officer or something crazy like
Yeah.
that. But these are, the bites that come reported to us, they come from a doctor or a police report. So
Okay.
most often if someone, like, if my cat bites me at home, like, will I call the health department? I don't think a lot of people know that we even handle that,
Yeah.
so. If they go to if it's bad enough to go to the doctor or have the police called, that's usually how we find out about it. And then, we're gonna talk about our rabies vaccine ordinance in the city. So we wanted to look at how many animals at the time of the bite are vaccinated and how many are either have never been vaccinated or they're expired on their vaccination. So overwhelmingly, a lot of them are not. And, this doesn't include the wild animals, by the way, but very small amount of the total are vaccinated usually. So then we're gonna give them an opportunity to do that.
Do you lump the stray animals in as unvaccinated, cause you don't?
Yeah, we count them
Okay.
as unknown usually, not like no or yes.
Oh, okay.
With the animals that were not vaccinated, so these numbers, they don't include the 18 to 20 that were vaccinated at the time of the bite. A number of things can happen with those cases. One of those is they'll be sent off for the lab, so if they pass away, or if they can't carry out their 10-day quarantine, which we'll talk a little bit about, we're required to have them tested at the ODH lab for rabies, so they'll be submitted for that. And those have actually, they went up a little bit and then they were down in 2022. I think they're up in 2023 though. With the court filings, this is where we are never able to make contact with an owner, or we make contact with them and then they just kind of stop working with us. But we try to get them to vaccinate the animal if we find that they're not. So if they refuse or we never make contact, then it goes to court. The strays are in there, so we had a lot of strays in 2019 and thankfully that's kind of starting to decrease a little bit. And of course we have our wild animals, which they're just gonna continue to be wild animals. The animals that, well, the owners that go to court and then they try to have them vaccinate the animal, it's not too crazy of numbers how many will actually go and get vaccinated, or they might get vaccinated and we don't get that information, but it's kind of confusing. It goes 2019 to 2022, and usually we do have success with a few of those cases. This just talks about the Ohio Administrative Code, mainly that you're required to report an animal bite within 24 hours, and this usually will come from a licensed vet or a primary care provider that has knowledge of a bite. And we're required to submit information to the state about those bites every year. And another part of it is that the biting animals must be confined for no less than 10 days, which is meant to be the period that we're observing them for symptoms. Our city ordinance says that every dog, cat, or ferret in the city greater than 6 months of age must be currently vaccinated against rabies by a licensed veterinarian. And this is what I was talking about with the Ohio-Pennsylvania border stuff. I just think it's really cool because they know that there's a lot of rabies coming in from the eastern part of the country. They'll drop these little like tablets of vaccinations that animals will eat, and that is supposed to be a way to kind of prevent that from making its way north and west. And this is what it looked like. They actually just finished, which is really cool, on August 21st of that distribution in Ohio. So you see mainly in the eastern side of the state, but it really helps us not see it as much over here in Butler County. Kind of our procedure with our health department, once we found out about a bite, we'll place the animal under a 10-day quarantine, again, to observe them for symptoms. We follow up at the end of the 10 days to verify that the animal is alive and healthy. The owner at that point has 5 days to either provide proof of a rabies vaccination that was current, or they can go get them vaccinated. If the animal dies or is euthanized before those 10 days, we have to test them. And if people refuse to vaccinate their animal, then it goes to court. We actually have had a couple incidents in 2023 where myself and Janae have been bitten by dogs during the visual observation piece, where we're trying to make sure the animal is alive and healthy. So we always try to minimize contact with the animals, but in both of these cases that couldn't be done. So we're trying to update our policy to prevent that from happening again. We've talked about doing this from a car and just looking at Fluffy from the window or something like that, but that's something we're working on with our policy. And I just wanted to talk about the local health department's role in rabies prevention. We, in Ohio, investigate about 20,000 animal bites per year across all the health departments, which is crazy. And it really, I think, contributes to the overall health and safety of the community. We don't have to worry if I'm walking down the street that the dog's not rabid and it's gonna attack me. It helps me feel safer. It also prevents rabies from re-emerging. So thankfully we haven't had a human rabies case in over 50 years. We don't want that to become a problem again. And it's also important to educate the public on why rabies vaccination is so important. Thank you.
Very good.
Very important.
Thanks, Sarah.
Yes.
Do you have any questions?
I woke you up.
I know this isn't really in the health realm, but when it comes to designating an animal as vicious, or I can't remember what the term is, I know the ORC, I looked at the ORC at one point because I was actually house sitting a dog, and I had neighbor dogs, there was a pack of pit bulls, and they chowed through my entire fence, came into my backyard and killed the dog. It was totally like, it was terrible. But when it's dog on dog, the law doesn't care. So, interestingly enough. But when it is a human that the dog bites, I think the first incidents, they're then, I can't remember if it takes 3 before they're like considered vicious or something.
Yeah, I know
And they
there's
have
like
to put
a
the dog down?
dangerous and vicious, and usually like we'll work with the dog warden on that, but we don't designate them, so I'm not
Right.
exactly sure.
No, and
what
I
each
guess I'm not really
number-
asking you so much, it's
Yeah.
just kind of like, it's kind of part of the discussion, because obviously a dog or an animal that bites someone is now, goes into this process, but I think they become labeled as a vicious animal, and then if it happens again, I can't remember if it's 2 or 3 times, that's when they actually have to like, put the animal down, but, yeah.
Yeah, and I told Carla, I think it would be a good idea for us to work closer with the animal warden, because we can kind of reiterate what we expect out of our residents and then what they expect out of them, because it's two different things, right? When they go out, and so we were trying to get a meeting. She has an odd schedule, but we were trying to make sure we get a meeting to talk, to make sure we're on the same page and saying the same thing, because when she goes out to talk to the residents or the family, we can say the same. I think it was you guys remember me telling you about that little boys that were on the bicycle and they got bitten by a pit bull, and it was on the butt cheek, and it was terrible. I mean, this bite was, remember we seen the bite, it would just make you cringe. It was terrible, both boys. And I'm like, this is traumatic, and she said, well, it's not the worst I've seen. She said, some people lose limbs, and I'm like, okay, it's not a limb, but it was, I mean, you could tell the hole, and it was bruising, and just, you know, real deep gash marks or whatever on it. I said, they'll never wanna ride a bike in an alley again, it was loose. And she said, well, it's not the worst we've seen before, and I'm like, so anyway, yeah, I think you're right. I mean, sometimes, I think some of those rules should be a little.
Yeah, I just like to help
clearer,
educate people,
straighter,
because
yeah.
I didn't know. I'm thinking, oh, this dog, well, the dog also bit someone this incident, so it did go, anyway, but, anyway.
And often the inspector's cases, both times, I think one, he got out of the door, right? Cause you know how dogs can get past like a little screen door, and then another one got away from a child. And you're not supposed to have vicious dogs, or, I mean, a child, it has to be 18 and older or
was
something like
probably
that.
19, but
Yeah.
yeah, it slipped a
It was-
leash. It was
yeah.
a really strong animal.
Yeah,
and it
so, you know,
slipped
they
it
could get away
outside.
from you, so.
Thank you, guys.
Wow, thank you.
Sarah.
I'm glad to hear we don't have a lot of cases of rabies.
Yeah.
Sounds like there's a lot being done to prevent it. Okay, old business, Fab.
Oh, Fab, we're still working with Fab. Our annual report is coming up soon. I know we'll be working on it next couple of months. So once you're accredited, you're accredited for 5 years, but then you have to do annual reports. And so those are sometimes not as painful, but that's coming up. And then we will be meeting shortly here soon, finishing up our CHA to present to everyone. I think CHA is on Butler County's website. They were getting feedback then. I have to check with Nancy and see if we need to get ours out just for comments and questions, but we're gonna start presenting that. And so, again, when we get those dates, we'll let you guys know. I mean, you'll all be a part of it. Unfortunately, you'll probably get a part of it multiple times, but you'll get all the different data that we receive back, just trying to polish up
It's
some of them.
community health assessment, right?
Yeah, CHA, the Community Health Assessment, I'm sorry, yep, try not to do acronyms. But that's what's going on with FAB. And then, moving into
Tobacco
Tobacco 21? Yes, I think it's in this packet. Carla put in a nice chart about density. Did you guys see it? Yeah. And we are moving forward with speaking, the city manager supposed to, he gave us a permission to move forward to present to this city council. Tell me if you've gotten that information yet, regarding density, and density.
Oh, boy.
Huh? Yeah, thank you. No, but this is good, this is a good chart about density.
I'm feeling sick for
Did
that.
you didn't have that in your packet?
It's up in the front by tobacco.
Oh, it's in
21.
here, I was
Yeah.
thinking it was in here.
Yeah, and it tells you how to reduce retailer density and why, and it's different ways, capping the number of retailers, or cap towards, relative to the population size. That's what we had talked about before. If we went strictly to half of the retailers, we didn't wanna do that. And you can make sure that pharmacies do not sell, so this is the difference, the different ways that you can do density for your tobacco 21. I think we're gonna lean towards capping the number, and I think, the city manager was comfortable with that, capping the number. I think I even spoke with, a councilman that said we can look at capping it, like at 70, wherever we are at the time we actually start this, and then start decreasing it if we see it, deem it necessary too.
Is
So
that
it's just
per
coming.
population size?
Not per
or
population
just
size,
per-
but just, yeah, just, get it down to a number that everybody feels comfortable with. So, to be continued, but, our tobacco 21 is moving fast forward. This would come from another department like zoning, or, what's the other one? planning, something like that, if they decide to do some of this.
Yeah, we're
They-
getting a little short on time for it all, aren't we?
And they also said that it may not have to go through any of it if it's in the, if you do the amendment correctly, so that's legal, that's
Oh,
outside
they
of
didn't
my.
mention that
yeah.
last time, did
Yeah.
they?
So, thank you,
Would've been nice.
Amanda. So, that's the update with Tobacco 21.
You said you are presenting to city council?
No, the city manager.
Oh,
Because
okay.
I think, last month, Deborah had given us the steps that if you wanna start doing that, it has to come, a order from the city manager to city council, and then city council has, so it's kind of like out of our hands, but they definitely said they're wanting to prevent escalating, amount of retailers selling the tobacco.
Who is they,
so.
staff?
They being some of the city, some of the council members that seemed not opposed to it, but it seemed that they were,
Fabulous.
yeah. So, yeah.
Education, good job.
So that's it with Tobacco 21
Okay, brings us to new business and travel authorizations.
in your packet.
Oh, yeah, that's right, this is,
This is the
what, like
fall-
tomorrow?
Yes, that's the one I said that was
Right, yep.
coming. So this is a fall conference where Carla and Dr. Genowine and I go every year to Columbus. And the information is in the packet. We put the total cost in the packet of what it costs. It usually ends up costing us a little less because of the workforce development and et cetera. So, with our workforce development money, 100% of your travel can be paid for workforce development. So that's good. It doesn't, cost us quote unquote, but then some of the things happen, like Carla and I will travel together and that kind of stuff, so it saves money, but we just put the total cost in the packet. And if it's any questions for the travel?
Do we have any questions? Do we just have one approval that's needed, like a blanket?
Yeah, I think you can blanket it, the fall.
Your name was on all three of that. There were three, and they all had your name on it, but I guess
And the
that's for all
travel
three.
request?
That's for all three people, I guess.
I see
Under
Dr.
official,
Genowine.
official employee may not have a wish list.
Oh,
Yeah,
okay.
yeah.
But I
Jackie
mean,
is at the
just, cause I
bottom.
saw the same thing 3 times, and I
Yeah.
thought,
Yeah,
it
she's
must be
as-
for the 3 people.
Yeah, she's as the requester, but the
Okay,
actual at
that's
the
fine.
top.
Yeah.
Yeah.
Good catch, I like
Just
it.
to let you know, I
Yeah,
read it.
you-
Yeah, I was gonna say.
I'll just-
Nicely
Yeah.
done.
All the documents.
Yeah, I'll show you those documents.
Okay, do we have, a motion to approve the travel authorizations as presented?
So moved. Second.
All in favor? All opposed? Okay. Let's move spot. Okay, we have the second reading of ordinance number 2023-01. Okay, do we need to do we have a motion to read ordinance 2023-01 and 2023-02 by title only?
So moved.
Second.
All in favor?
Aye.
All opposed? Okay, that lets us not spend forever reading the ordinances, so thank you. So the first one is for food fees, and the second is campground fees. We did the first reading last time, and we have a third reading at which we vote. Is that right, from Board of Health? Okay. As you can tell, this is the first and second of the entire year, so we don't do this very often. So we don't actually make a motion then. Do we have any comments or questions on either of the two since the last meeting? Since we're not voting on them, we just made a motion to read them by title only for the
That's
second
correct.
reading. Okay. Alright, these logistics. Carla, do you have anything you wanted to add, or?
No, we haven't received any response.
Okay.
So-
Okay, if anyone has questions, we're happy to help sort through them at any point. So then that brings us to any open discussion topics that board members have. Anything anyone wants to bring up this week? I did hear last night that the school board rescinded its funding for the community center,
Mhm.
so that's kind of a big deal.
Yeah,
That was a really big deal, actually. So Sunny Hill project is up in the air as to
Why
what's
did
happening.
they do that, or what's behind that?
There was a $3 to $4 million gap that they felt the city should cover, and the city
Said no.
said no. Yeah, So I think they shifted the funds to a transportation project instead, I believe, so, to be determined on what happens with that. In my mind, the senior center is now an also like, very large building providing services. I don't know, we'll see what happens.
Continue to divide the community of what's important.
Yeah.
I mean, I had a whole lot of comments about a lot of people that worked hard in those areas. And again, we changed direction and a lot of people felt like their time was wasted.
Oh,
It was
sure,
very-
yeah.
Very disappointing, but
I
we'll
think
move
there's
forward.
opportunity to use those efforts
if
in
you
another
get,
way.
if you get people involved and encouraged to come out.
And I'll
It's
say, I
disappointing.
also think that this topic it's interesting, the senior center and the community center, and I feel like we're like not addressing the underlying racial divide, I'm just gonna say it.
Yeah.
It's in Middletown, that we kinda continue to spend millions of dollars
Mhm.
to support. So I'm hoping that this happened for us and not to us,
I hope
and that maybe we can bridge a gap, that we can work together and do something great. Because I see that we're like,
Well,
we're
it's
supporting two
Well,
things
it's
that.
everything that's, I can report on like Central Connections. I mean, sometimes the older population will say, we deserve all of this and not the kids. And younger populations say, we deserve things and not and so until the city gets a vision and starts bringing everybody together, because young people become old people, you know what I mean? And what's in it for everybody, then you're gonna constantly keep saying, don't spend that 50 cents on them, spend it on me. And it'll continue to be that way, and most people that can not suffer through those things, they'll leave and not suffer for them, and then you'll just constantly keep having those, social ills and social problems that keep dividing communities.
Well, being a senior,
Mhm. Mhm.
still just what I read in the paper and everything, but, it's really not the city's thing to support the I know that there was something there, I read it and everything, but I don't know that you're, that's why your job and all this is so thankless, but, there are two sides to the
Yeah.
deal, and, we're gonna save it, and the money, we're already paying taxes on it, we approved it, and now they want the city to bail them out, and it's really not the city's purview to do that, really.
Yeah, I mean, the citizens
if you-
paid the mortgage off
Yeah.
on that building. Now, the concern if we don't step in as a city to get the building is that we just wasted all that money. That, in my mind, that's.
Well, I'm just saying though,
I
that
know.
it's just,
I know.
they're not, are they really obligated to do that? Not really.
No, not at all, not obligated. I feel like there is a possible opportunity to combine our youth and our seniors into one facility. I feel like we would, one, save a lot of money, and two, create cohesion in the community that we don't currently have. Because the issue though is locations, right? And so
Yeah,
that's
right.
where we get into
Yeah.
this racial divide that really hurts me. Like, I don't like to see that, because we have such great people in all communities and all races, and I feel like it's a little bit of the underlying issue that's going on, and I don't know how to get around that and get through it, but maybe this will help us actually talk about it. And I do think that there is still a need for a preschool, and that's the problem with that
It definitely
project
is.
going away at the community center, which was never supposed to be a preschool. We did not know, I did not have any idea that that's what was going on there. I'm glad that that there was a preschool involved in the end, but now, with that not being there, I feel like there is the census tracts, there are census tracts around there that need a preschool in that close proximity.
Right.
The community center aspect, if we have transportation and that's easy to access for people, then does it matter where the community center is, as long as it's somewhere centrally located? I don't know, that's a question that we have to come to the table to answer, but if the existing senior center could be a youth and a senior center, for basically a community center, right, for everyone. I mean, that's Mason's model that we know, okay, I hate even saying Mason because they have $1 billion more than us, but their model is working, and can we do something that is, at least tries to be inclusive of every age demographic? There's a lot of land there. It is what was intended when the land was given. I don't know, I'm just saying it because it's gonna come up. So from a health perspective, obviously there's a lot of health aspects that are involved in how we address both the youth, the seniors, and the whole community. And we have to at some point figure this out.
Yeah, and the problem with moving it to a central area, which sounds good, but when you do not invest in all areas of your city,
Sure.
you will have areas that are neglected. And that's why we talk about Amanda area, that's why we talk about, the Rosa Parks area or whatever. So if they continue to put the aquatic center on the east end, if they continue, because it's better and it's easier, and then the YMCA, and it makes it more affordable. And so it's got a lot of reasons, good reasons for it, but when you don't find the good reasons to do something else in those other areas
Sure.
of town, and there's usually no other reason to do it in those areas of town, because they'll say, a lot of crime, a lot of bad infrastructure, so they find the reasons. And so you're constantly fighting the battles of all the other things that come along with that. And so, yeah,
Yeah.
it just needs, and if we, as a city, and this is my last commentary, get a plan where people can work towards,
Yeah.
because everybody gets out of their feelings, and then we settle on a plan and we work towards it, that would be beneficial for all, instead of, saying that, I spoke on behalf of the commissioners, as far as saying how important preschool is, and then now transportation's more important. I kind of feel like I was misled, but,
Right.
it's just frustrating sometimes. Can we just get or let's just be open and say, plan A is this, plan B, if we don't get this, is this, and just be maybe transparent that way. So, that's just some of the comments
Well, the
people were
Middletown
very.
Foundation gave a lot of money, cause I was on that board, and I gave money, we all, a lot of people in town gave money for for that program. for
Right.
Preschool and everything, and then I left, I don't know what's happened with that, but
I don't know what the plan is
that was
for-
the biggest
See, yeah, I don't
thing in
either.
town for a long time.
That's another thing too, I don't know.
Yeah, more to follow. I guess I just wanted to kind of
Mhm.
stir the pot on it for now. Just kidding.
Well, it's
I just
good,
wanted to mention
and
it.
this is the kind of stuff that it's good for a community to talk about, right? Cause you don't have to always be on the same page, but you need to be able to communicate and talk. Everybody gets their things out, so hopefully, I agree with you, hopefully we'll get to a point where it's a good opportunity. for
Yeah,
us
I don't
to-
know what the best route is forward, but we need to talk it through, and we need to actually talk about what the real issues are, because I think we're not talking about what the real underlying issues are and why we've got, I think, ourselves spread a little thin.
Yeah,
But we need to do something, obviously, to help the census tracts that are in need. We also need a way to unite the community, so how we do that, we'll have to figure that out.
Better representation on city council.
Oh,
Those neighborhoods need representation.
Right, and so I think
Mhm.
I think we look at city council like it's the end-all be-all, and sometimes it's not. And so I think that this neighborhood initiative has the potential to do that without having to go straight to the 5-person entity that everyone thinks is the most powerful thing in the city. Like, I actually don't think that that's always the case, right? They vote on stuff, but they should be listening to the people, in which case, if we had this neighborhood board or commission that does thus represent geographically the entirety of the city, if that was ultimately looked at as the voice of all of the neighborhoods that council and city staff could go to and make sure, give themselves a check, then you don't necessarily have to have people in all these wards, if you will, right?
Right.
Who are spending the time doing the thing on council, because I think it's
Right.
also a hard ask to find people in all the different wards who are good representatives, who are willing to put that effort in. And even if you get that representation for 4 years, is it sustainable that you can continue to get people from those neighborhoods to do that thing? And I think that's where maybe it didn't always pan out. Sometimes we don't get anyone running for council. It's like So I think that the neighborhood initiatives that are going on are really good and maybe will help bridge some of the communication gap. That's my hope. I know they're working hard on it.
Yeah, that's fun.
Okay, well, that was exciting. We've always got something good to stir the pot, don't we? Anything else for open discussion topic? Dr. Zoll loves it. He's like, let's.
Well, that's what the problem in the town is,
I
to be
know.
honest, but like you say, you go to again, I've been to 2 council meetings in my life, for that second. You know, and instead of trying to discuss it, it becomes very adversarial right away, right off the get-go, and, you know, the reason you're there and trying to do some good, and right away, you know, you're limiting, business in Middletown, you know, but,
Assume best intent.
we had the
That
best,
is a-
we had the best intent, I'm not sure.
I know, but
I'm not sure
I
they
wish
did.
we, you know, if we can all get to that point and then we can maybe get something done. Okay, are we ready for Health Commissioner report?
Yeah, I just have a couple of things. I've handed out to you some of the things I'm working on. The biggest, it has been, Central Connections. I do believe that agreement with the city and the board was signed around August 23rd, August 24th, which means we're leasing the building, like the paper said, it pretty much is in there. Leasing the building with, hope to purchase the building. But what we're trying to do is keep the doors open and keep activities going. And they're a delightful bunch of people. I keep saying we are a delightful bunch of people, cause I'm one of them, I'm 63 too, I'm just haven't sat down, it's not working yet. But, they're delightful, and it breaks your heart because they do look forward to coming in there. However, we're looking at probably about 150 people tops that come in there, and the majority of the people that come in there are for silver sneakers, like you were saying. So right now, we have, some volunteers out front. There are the two I'm talking about is our principals, and they're, you know how teachers are, they like to get things done and stuff, so they're going through all the memberships and trying to find out active, not active, and things like that, so we can get some information. We're trying to figure out, the class got too big for silver sneakers, so they were gonna change the name. I'm like, no, it's gotta be a reason for the rules. So let's keep the name, that's fine. So we're just trying to work through all of those kind of things, making sure that everyone's safe out there and they can get in, so that's what we're doing now. I think I'm gonna have a meeting coming up shortly with the city managers. If you guys had not heard yet, we have a city manager, Paul Lawley, and then we have 2 assistant city managers. We have Nathan Cahall and Ashley Combs. They're the assistant city managers. And we have a meeting coming up so we can kind of start thinking about just what the Central Connections is gonna look like how long and how far. I do believe they want, the ultimate goal is the city to get out of it and somebody to take over so we can continue to be thriving, but to be continued. But I think we're at the point now where we'll start meeting with some community partners to see what else they can bring to the center and how we can even find other activities around the city that if it doesn't fit the center, if they can find it some other place. So for instance, I'll give a good example. Most people that we're really concerned about is the seniors that need to eat, right? The food issue, as well as socialization and transportation. Those usually happen between 8 and 5. Most seniors don't like to be out after dark. So evening activity would come from those other seniors like me that work all day maybe and wanna come to exercise class at night, Tai Chi or whatever. And so we're trying to look at can the center be open in the daytime for those first important needs, and then I take classes at your place. You know what I mean? Just try to get some connections or whatever to give people some choices and opportunities to go out, so.
Well, just from feedback that go to both places,
Mhm.
that we were not represented in a good light, that we were stealing members, stealing silver sneakers. We were just providing them
Service.
another opportunity,
Absolutely.
but I don't feel that the staff was letting the senior members
Right.
know, these are other places you can
Right.
go.
Right.
So I feel like that needs, they need to be educated on we're not offering this, but these are the places that are.
Absolutely, and that's what, because that's what makes us better, when we have a lot of different, diverse opportunities to get out, to make sure we can support everybody, so, yeah, it's the whole.
It's about the not, where nobody's
Right.
stealing anything, we
Right.
want to offer.
Right.
We don't get grant money, we have to charge something, so.
Right,
That's where a little bit of the.
Right, so that's where we're working towards now, so that's one of my reports.
What
and-
about the health aspects
I don't know,
of
it just keeps
the
going on.
senior center, because that was the entirety of the reason for the lease and.
The health
Yeah,
side of
like,
it?
not like physical health, but like, access to health care and.
Hearing aids, just
Sha-
different. like
yeah,
different- Mhm.
That's how it was told to me, that there's some health benefits of like a, what am I talking about, like
Well,
doctor, nurse checkup stuff.
Yeah.
Bridging the gap.
right, yeah.
Yeah.
Helping, we had, premier screenings over there, and it wasn't a whole lot of takers. I'm noticing, and I have to wait and see, because it may have been a disruption
too.
with all the trauma of the center, it may have been a disruption, but the, seniors that I'm seeing over there are basically coming over there for socialization. I mean, they're paying cards, and I'm not kidding, they're playing cards, billiards,
Mhm.
they wanna do carry-ins and that kinda stuff, yeah. And so we will see, it's very important, they love chair volleyball, that kinda stuff, volleyball, they
Yeah,
like
I
that
just,
kinda
that's
stuff,
a
but it
little
wasn't, I know.
frustrating, because I was told mission critical life
Yep.
saving,
Yeah,
and it's not that I don't want them doing those
Yeah.
things, however.
Right. Well, and you know what I'm looking into, you guys, and you go keep your ears to the ground and help, and I think we have other seniors at the table other than me that can speak up. Look, I'm looking at Sally and Dr. Zollett, Jeff, but I'm thinking too that there are different pockets of seniors in our community, right?
Mhm.
So we have seniors in the senior living homes, Trinity, Mayfield, Dublin House, those seniors. And I think they have like a little community room where they get socialization downstairs and whatever, so you have those. Then you have nursing home seniors, that may be in assisted living or nursing homes that may come over. And maybe they're not coming over because of transportation, so we have to try to pick that up, maybe not. Then you have seniors that live in the community, that are coming over there, meeting their friends and playing cards or playing different things like that, bingo, those kind of things, that social part. So I have to wait and see too, to see how much maybe they're not coming over, but when they have Premier that comes once a month for screening, they didn't have any takers for the screening there. Now, they have requested us to do flu shots and to make sure flu shots are done and, RSV and those kind of vaccines to be done, so it's that time of year that we could set
But
up
were
a
you
program
already,
over
I mean, I
there.
imagine you were already going over there.
They had a pharmacy that
past.
came over there in the past, yeah, that did that, yeah. So we have to just see how that pans out, yeah. So we're trying to weigh that out too, to see just how much. I think we did a good thing to close it by 4:30, because as you know, the evening people would have been, not people that need to be socialized or whatever, they're coming over there for different. So we're trying to get down to some basic mandated stuff, if you will. So we're gonna still watch that, and I think when you were saying a community center, if we're trying to get back to a community center with youth and seniors, then that would be, the direction to go, right?
Yeah.
Because I don't think it's, I think they become accustomed to having something to do and coming over there or whatever, but I don't think they're they're not shut in.
Right.
Okay. Does that make sense? So I'm just trying to figure all that, but right now, know that there are volunteers over there, and I'm just kinda overseeing it, like when paper towel and toilet papers got taken out of the bathroom. I was able to say, Neil, can you go over and put them back in there before the silver sneaker class got out? So we were cool, so I'm just that kind of like, putting out fires, that kind of way. And then the seniors pretty much run it themselves, and then our volunteers are helping them guide them around, so we're not investing a lot of manpower in it, but we are, it's other monies that's involved, so.
Utilities
that,
alone,
yeah.
I can't even
Mhm.
imagine.
Yeah,
Such a huge building.
it is a huge building.
Okay.
We have a big meeting today at 2:00, I'm not sure what it's actually gonna be about, but it's with the homeless update. So it's with Scott Rasmus, Dr. Rasmus with the Mars Board. and Cindy Carpenter. And so
Is
to be
that just with
continued.
Middletown, or?
It's just with Middletown, and yeah, it's just with Middletown. And, we're gonna continue, I talked to the city manager, we're gonna continue to push that this is a county effort, right? And so, to be continued, we're still pushing
Yeah,
for that.
was that meeting since our last Board of Health meeting, the one in Hamilton?
Yeah, after that one, yeah.
I think we,
Yeah,
so we
the
met
one
in
you met
Hamilton.
with George Ling?
Yeah, with
Mhm.
George Ling, and Jackie was there, and I think Zach was there for 5 minutes, but I think aside from that, I think we're the only two from Middletown.
Middletown.
Um,
Steve came from the courts. Steve was there.
That's right,
Yeah,
yep.
Longworth.
The message really was, the county commissioners are wanting to put homeless programming in facilities across the county. Namely, they want this crisis center in Hamilton. It was very clear the Hamilton staff and elected officials did not want it in Hamilton, which I did not know that was,
Oh, yeah. Yeah,
I just
that's
haven't, I assumed they probably didn't, but I also thought, well, I hadn't heard anything, so
Mhm.
they pushed back quite a lot on that. And basically both Middletown and Hamilton said, we're kind of tired of being the only ones doing anything, and the state needs to step in at a greater level as well. That was also a message, right? So the county, I think, is trying to take things under their wing in absence of the state really doing a lot. So I know we had
Mhm.
talked about this a little bit before, right?
There was something in the paper this morning about $8 million.
So they have allocated money, I
allocate.
believe, and what they're gonna do with it, we don't know yet.
I'm hearing,
What?
What are you hearing?
4 million to Middletown and 4 million to Hamilton. I don't know how that would go, because I
This
said.
is one time where I'm like, we don't want the money.
I know, because, I mean,
We don't want it.
like, you don't want me on record saying that, but I'm like thinking 4 million with unearmarked give us the money, but you still handle the problem. $4 million will not go anywhere with the homeless situation. I mean, just the staff
Well,
alone,
There's
the time and
expectations
effort
that
you
come
put
with
into
that,
that.
is
Yes,
my problem,
exactly.
like, what
So-
do you,
More to come, but yeah, we were like thinking like, that would be a nightmare, so. Yeah, I think that's the time that you really wouldn't want money without a plan. It's easy, I mean, and then it kind of bothers you that they can give you 4 million now. But that's a whole nother thing, I think I'm getting ready to get unelected.
as long as we don't end up with dignity buses.
I know, right? But you know what kind of scares me, understand too, Hamilton has two big homeless, initiatives there. They have Serve City and they have YWCA. So that money could easily go there, and it can enhance those programs that they already have. With Middletown, I don't know what that would mean, if we would have to build it or something, you know what I mean? It just, like you said, it comes with a lot of responsibility, so we have to be careful with that.
Yes,
Yep.
I've heard Paul's suggestion.
Mhm.
I'll wait to say that. Stir up a hornet's nest.
I already have
Anything?
conference on there. There is a Ohio Association of Board of Health. If you guys are ever interested, I think Dr. Patrick used to attend some of those. It's a meeting in the packet. I mean, it was like, I thought it was in the packet too. Is that it? Yeah, and if you guys ever interested in any of these things, let me know. You can sign up for it. We can help you sign up for it. We would pay for it. It's a workforce development, opportunity. And they always tell you what, the agenda behind it is. I think Tobacco 21 is the topic of this next upcoming one, so just let us know. I was gonna make sure. I'm gonna finish with Middletown Connect. Gem City, I met with Lisha Moreland. She's an Assistant Economic Development Director, and a company or a place or people or program called Gem City. And it's Gem City Market, it's in Dayton. They are trying to do other markets, but it's like a co-op type community market. And so we met with them, we're gonna continue to meet with them. It's an opportunity to put sometimes community markets in areas where they may not have grocery stores, The one in Dayton, they have a little garden behind it, and so they have all their produce that's inside there. It's a beautiful market. You could Google it, Gem City Market, Dayton, Ohio, and look. But what they do is they bring the community in, and they let the community be the workers and the stockers and all of it, and you just kind of, it's a way to kind of empower your community as well. I stopped in twice, and it looks just like it does online. You know how sometimes you get the pretty pictures online, but it's very clean, very organized, shiny floors or whatever. And I think they're looking, it's a co-op program, but I think they would like to place it other places, and they could help us with writing of the grants and that kind of things. You would get the hospitals involved and community foundation involved, all these different partners involved to do it, so. And we have a lot of land in Middletown that Lisha's looking at. It would be a great place to maybe put one, I think they were saying maybe where the paperboard is. That's it, yeah, it's a good place. It's, you know, it's before you get to Marsh or Needlers. I always say Needlanders. And it's before Kroger's on both ends of town, so it could be a small little market there that you can have things. So, that was exciting, nice people. And last but not least, I put on the table, the Middletown Connect year-end report. It's really quick reading, as well as, our press conference last week, was it last week? It was August 29th. It was over 50 people that came, and it was a really quick summary, and that's where you have this article in the paper with Debbie Hauser, because she spoke at the meeting, so. And I'm gonna also send you guys the, link to the video that they played. That's pretty cool. But these are the maps. Our next steps are to go into Amanda and the Wildwood area. So that's what we are getting ready to embark on now. The ambassadors are up to now 28 people maybe in these areas in the 3 census tracts that we worked on. And you're right, they're picking up steam as far as things that they want. They are calling with nuisances. Yeah, they're getting right on it, so the neighborhoods are looking good. They're encouraging people when you go for a walk, take a grocery bag or take a trash bag and pick up. And so they're doing things like that. So I think someone said they're gonna start going to the council meetings, school board meetings, and park board meetings, and they're gonna start joining some of those meetings. So to be continued, but that's that grassroots initiative that the mayor was speaking of, like when people start getting involved and having a voice. And I don't know, I'm really excited about them. The last meeting, it was really a full meeting, and I was really proud of them as far as they enjoy being involved and getting, coming out and getting involved. And so, to be continued, we'll let you know what's going on in Amanda area, and I will let you know too, Sally, because I know you said you wanted to be involved more over there too. Sally came out and walked with us and picked up trash too, but I'll keep pulling you guys along if you wanted to come out and just be a part of some of the initiatives. But that is one part, I think, that if we keep getting the traction, it's kind of like slow while we go, but it was pretty impressive when you saw the whole video and then the people there and the schools, how Debbie talked about how they did things really different with the schools when they got on the buses and they went to every community, and how she told the teachers that you can see some houses boarded up and some $1 million homes, and how these are the students that you're teaching, and I want you to live it and breathe it, and I want you to see your students in the day and come play with them at night. And she's encouraging them to be more of a community. So that's just another effort. I'm done, thank you.
I saw the disruptor.
Yeah. My cartoon picture, I know, I told you, I know, and Deanna looked cute like a little kid in there. I'm like, there was a little cartoon pictures of us in there. So, yeah.
Okay, is that
Thank
everything for you?
That's
Jesse?
everything for me.
Okay, Dr. Genowine.
Affordable illnesses for the month, we had 29 chlamydia, 12 gonorrhea, 8 hepatitis C, 2 hepatitis B, 1 syphilis, 1 Shigella, and 1 CRE. And that pretty much sums up. I'm sure all of you saw the FDA finally approved the newest version of the COVID vaccine, and they're hopeful to have those out as quickly as this weekend, rather than, so. You know, I think a lot of patients have been holding off to get that last booster, waiting for this vaccine, so it's good timing to be available. That's all I have.
Thank you. Chandra?
Okay, I'll piggyback right off of the COVID vaccine, thing. The state has, initiated us to do some pre-booking for the order of the new COVID vaccine. So we will be tasked with, vaccinating, much like our flu vaccine, the and underinsured population. Whereas before COVID, we gave it to anybody and everybody. So now we will focus our attentions on that population and provide the locations as we find them for folks who have insurance, like their private physicians who do order it, and the local pharmacies, who will be getting their vaccines quicker than we will. And that's just the normal for any vaccine. We have pre-booked and are awaiting our flu vaccine from the state as well. So more to come on that. We'll post when we're able to vaccinate the public, once we receive that. Our COVID cases are on the rise, but that's kind of nationally. But for Butler counties, from July numbers to August, it was up almost 300%. It was a pretty stiff climb. Mostly, you can kind of relate it to the high temperatures cause people to go inside and congregate inside together, and then school going back in session. So we're gonna keep a close eye on that. Hopefully, now that the temperatures are getting cooler, people will be outside again, but school is in, so we're just going to watch that population really closely. Other than that, I think that's it.
Can I say quickly, the wastewater surveillance has been tremendous across the United States, and we have it here in Hamilton and Oxford, and they can tell that big curve of the virus in the water, when they're testing the water, because they said a lot of people are doing home tests, and so you're not getting an accurate number with people. So if we say we have 30 cases, it's probably 130. But the wastewater, they're definitely seeing it, monitoring it, so it's proven to be really a good tool to see how the virus is going and where it is. You know what I mean? So it's pretty cool that way too. So just telling everybody, remember what you did last year. We were getting outbreaks here around the city, and people were coming back to me and saying, what should we do? And I said, you're probably around people with COVID. You probably find out a day or two later, watch for signs and symptoms, try to kind of protect others, test yourself after 2 to 3 days. We still have tests if you guys need tests, and so we still have tests. There are 2 in these boxes, so feel free to, on your way out in the hallway, they're right there. You can pick up some, or if you ever need some, call us, and we'll help you walk through that if you have it in your circles.
Okay. Carla?
We have approved and reviewed plans for Casanos on Verity Parkway. So I don't know if you've driven by there, but they've remodeled that store on Verity Parkway. Middletown City Schools has opened a virtual school program on Central Avenue. It's in the same location where Mid-State was. So yeah, so I think they have about 70 students right now that are attending that program. So
Does that have food involved? Is that
they
what
do.
you're-
We
okay.
license that location, or it comes from the high school and then they serve food there. So but it comes, they don't cook, but it's served there.
Okay.
We have, Verity Lodge is now open. We've licensed them as well. A Head Start is located there. Middletown Quick Stop has a change of ownership, and that is on Oxford State Road, so we've licensed them as well. And Aaron's Garden, close to home on Roosevelt, has closed, and now it'll be called Aaron's Garden. They haven't opened yet, but they're in the process. We're working with them to get a new license. And I think at Buster's Bar, they closed, so I haven't heard anything, but they're closed as well.
Where was that at?
Buster's.
It's on Manchester and
Charles
Manchester
Street,
Street.
Manchester,
Charles.
Charles
Yeah, they say
Street, down on the
Manchester.
corner.
Mhm.
Yeah, It's been there forever, yeah, so.
It shows up on the smoking complaint
Yeah,
list.
yeah. We haven't had anyone apply for a license there yet, but I'm sure we will. We actually have 2 pre-administrative hearings this morning with Jackie, and staff. One is for Taku. We've had some, compliance issues with them. So we'll meet with them today to see what we can do to help them maintain compliance. They usually will get in compliance once we go, but it's the same issues when we go. So we wanna see what we need to do to make sure that they don't have 100 violations every time we go back. And I think one thing they need is training, so we may mandate that they go and have some training for the staff as well. We also have an pre-administrative hearing for Pizza Hut. There are 2 locations in the city, one on Marie Drive and one on Verity Parkway. The issue, they had a new owner at the beginning of the year. When we have a new owner and the facility continues to operate, we usually give them 30 to 60 days more time if they need it to get in compliance. So they have to bring this, if the store is not totally in compliance, like there are maintenance issues or whatever, they have to get in compliance, and we give them time to do that. With these 2 stores, we did not get any feedback from the owner after the time frame was ended. They did not comply. So we wanna meet with them and see what the issues are. I did have the staff go out yesterday before the meeting. They complied about 99%, but that was after mandating that they come to the board, to have the administrative hearing. So we'll meet with them today to see if we can't get the remaining of those items corrected.
Pre-administrative hearings always come before,
The board.
before we have to bring them to the administrative hearing, which is you all. And then you all, it would be coming to you all with recommendations of what do you know, any kind of disciplinary actions or whatever, so.
Yeah, we usually work with businesses and really give them time, but with them, they just did not respond at all. The store didn't respond, the owner didn't respond, he didn't respond to our calls, he didn't respond to our emails to see why those items weren't getting done, so. We have finished our pool inspections for the outdoor. We usually during the summer inspect the pools and monthly. So now we'll work on continuing inspecting our indoor pools on a quarterly basis since all the pools are closed, all the outdoor pools are closed. Also, we are on track with our inspections. We've completed our first round of inspections, and that we try to have those done by August. So that keeps us on track to make sure we're in compliance with completing all the inspections by February.
You mean the
Standard inspections for the food service operations.
Oh, I thought you were talking about sewer. Okay, I don't know why I thought you were moving on to another.
Oh, sorry.
No, no, no.
And I believe that's it for me.
Is there any update on, I think maybe somebody had mentioned 513 was opening an Indian restaurant. Were you the one who brought that up?
Yeah, they've still closed, no activity with
Okay.
them yet, no.
And then the other one that came to mind that I've heard about is Lakeside Inn. Have you guys heard anything
We
from them?
haven't gotten anything from them.
Okay,
We haven't gotten
Just
anything
curious.
from them.
moving along.
Talk
Yeah.
about old.
I know.
Yeah, I was there when I was a kid. I
They
mean, a
have-
real kid.
So they started renovating it for the movie that went, whatever that movie was, and with the plans of reopening.
Wow.
You look like a little kid in a candy shop.
Well, I used to,
He's got memories.
I used to live really close to that anyway, but when I was, this big, but I mean, that's been there for,
It's been there
I'll
forever.
bet, at least 70 years.
Yeah, I think people would love to see it come back to life.
Like the Meadows.
Oh, God, please.
Meadows has been there for
When I was a kid.
forever.
Okay, any questions for Carla or anyone at that point? I guess we're at the end. Questions, comments? Okay, well, that brings us to the end of the meeting, so we'll adjourn the Board of Health meeting until October 10th at 7:30 a.m. Thank you guys.